Do you think system leadership is something that can be taught, or is it something you kind of learn on the job?
So I think you learn to be a better leader in general, and you learn through, obviously, taught courses, but you learn also from experience, from taking actions and learning what works and what doesn't, learning what works with people and what doesn't. So some of that can be taught through mentoring, coaching, guidance. Some of it, I think, is innate. So some people need clarity to be effective. So if you're the sort of person who needs clarity, needs certainty, you're much better off in an operational job where you've got direct line control over a given number of people whose tasks are clearly defined. If you're going to be an effective system leader, you've got to be able to live with ambiguity, and you've got to be able to still find a way forward even in the midst of ambiguity and complexity, 4 steps back, 3 steps forward, and sometimes 10 steps back, and maintain your motivation through that. Now, some of those qualities are not taught. Some of those qualities are innate in people. But I do think that you can help somebody to learn to be better by guiding them through experience. Now, one of the weaknesses we have at the moment is there's not that much space for people to fail and to learn from that failure. It is about trying to bring people together, to work together against a common goal. And obviously the challenge in it is if you don't have line authority, how do you get people to agree to do things that are difficult, things that are conflicted, things that maybe they don't want to do?
Right. And how do you go about that?
Well, a number of different routes really, but number one is to think about what is it that the population need, or what is it that patients need? What's the evidence for that? What's the case for change? What is it that, you can genuinely go out to clinicians or to the population and say, here is the evidence about what we're doing at the moment and why it's wrong, why it's inadequate. And if you can get that evidence together, I think you've got a powerful case for doing something about it that you can bind people into. Clinical leadership, often you can get clinicians to be willing to confront their own practice, that of others, in order to work towards improving outcomes for patients. But essentially trying to find the things that bind people together. And when they want to shy away from that for their own either personal reasons, organisational reasons, whatever it is, holding up the mirror to say, actually, what we're here to do is to try and improve things for patients. Here's the evidence. What you're talking about here is special interest, and trying to tackle it in that way. And of course, there is some authority. There is, of course, some authority in the role, and you can use that, but you need to use it sparingly. If you have to rely on the authority of the role, you've lost it, really.
And where do patients fit into all that? I mean, you're doing it in the best interests of patients, but is it important to involve them when you're trying to change?
Many services, patients only ever have one interaction with it, and subsequent to that, they hopefully get on with their lives and they're not that engaged in it. However, people with long-term conditions, particularly people with complex long-term conditions, people who make use of mental health services, people who make long-term use of services in the community definitely do have a role to play. So I'll give you an example. The changes that were made to stroke services in London, the Stroke Association with the patients, carers involved in that were very, very powerful advocates for change. One of the things that I've learned is how important it is to be really clear about a few priorities, and the NHS is really bad at that. We tend to say that everything's important, and it is. And if you try to set priorities, you immediately have people saying that you don't care about the other things that you've not prioritised, and that's difficult to live with, difficult to lead.
Is the NHS succeeding in growing system leaders?
Well, a whole generation of leaders were lost in the last reorganisation, and a lot of talent was lost as a result. So there's quite a growth needed of people to come forward now into these sorts of roles. And they can be very exposing. So if you think about the demands on a system leader, they are that you deliver absolute, transformation of services, that you do that in an environment where there's less money and greater financial pressure, and you do it with a reduced level of authority to that which you had before. And until recently, you do it in a political environment that's getting narrow. Obviously, recently, general election may free that up, but until very recently, the political environment has been extremely difficult as well. So that environment would place significant demands on even the most experienced leaders, and what you've got is a large number of relatively inexperienced leaders working in relatively small organisations being required to deliver that sort of transformation through a collaborative route, which poses complexities of its own. So I think it's a huge ask of relatively inexperienced people.
Yeah. What do you think could be done to help improve that?
Some of the support that's available for people in terms of the leadership that they have to provide is lacking. I mean, what people often get is they get told that's not good enough. You shouldn't have done that. This is you should have done better. You must do better, and you need more or different. There's not that much direct support for individual leaders.
No, this is just my impression, but you get the sense that there's kind of less mentoring of people, less. For a dreadful word, buddying up, less directly looking after people as they move into the more senior jobs.
So health authorities were criticised for lots of things, and in some cases appropriately, but I would argue that in the role that I used to have, I used to consider it a very, very important personal responsibility to support, mentor, coach, guide newly appointed chief executives. And when chief executives were in trouble, I'd like to think that they came to my door first to ask for help and to tell me about things that were going wrong and to seek guidance on what can and should be done and to offer, in a sense, an umbrella over some of the things that otherwise would have left people feel very exposed. And I don't think that exists. And
if you're looking at sort of big system change ideas, I mean, Manchester has come, in a sense, roaring out the woodwork. That would clearly be a very large system change were it to happen. Do you find that encouraging?
I do, and I think there's a huge amount of enthusiasm in Manchester for the changes that they want to make there. Genuinely does bring leadership from local government and health together, and a real opportunity to say we want to create authoritative governance for Manchester. We want to make changes across public service in Manchester, not just in silos. So there's a fantastic opportunity there and lots of things to watch and maybe learn from. I'm sure they won't get everything right, but some things to observe and to learn from. It'd be nice to see the same thing happen in London.
Right. And finally, what advice would you give to other system leaders? What one piece of advice would you give to them?
It's about resilience, I think, would be the one piece of advice, that if you have to be incredibly resilient, because people are going to say that everything's too slow. People who want you to do more will say it's too slow. People who don't like what you're doing will say it's too quick. If you pick these priorities, everybody who's not in the priorities will say that you don't care about, people say you don't care about mental health, you don't care about children, you don't care about their issue. And politically, of course, you're always extremely exposed. And therefore, that brings a level of scrutiny and heat with it, which is very uncomfortable, and so you have to be resilient in the face of all that and think, well, it doesn't matter, tomorrow I'm still going to come out and try and do the same thing.
Thank you very much indeed. It's great.
You're welcome.